If you've recovered from COVID-19, there's a good chance that you felt a sense of relief because you've developed some immunity. But how long will immunity last, and how immune are you? As Dr. Frank McGeorge tells us, it depends on how badly infected you were.
In a non-peer-reviewed preprint paper from the Imperial College of London, antibody levels were tracked in 365,000 people in England from June 20th through September 28th. Researchers found in June, 6% of the population had antibodies using a finger prick test. By September, only 4.4% of the people tested had antibodies. This is significant for two reasons. The decrease suggests over just a few months the immunity of the population significantly dropped. It also highlights that over 95% of the population tested had no antibodies, not promising for any level of herd immunity. Now, another study from the journal Nature Microbiology looked at the antibody response of 65 people with COVID-19. They found over 95% of the patients developed an antibody response after 8 days from symptom onset. However, the amount of neutralizing antibody produced was highest in patients with the most severe symptoms. Furthermore, people who produced the highest levels of antibodies did continue to produce them for more than 2 months after their initial infection. But for those who initially produced fewer antibodies, they became undetectable within a month and a half.
There's general agreement that antibody response is not permanent, but exactly how long it might be protective isn't completely clear. In fact, a study recently released, in the journal Science showed stable antibody levels for 5 months. The difference may have been the specific antibody they studied. Despite some lack of clarity surrounding its data, the AstraZeneca Oxford vaccine is currently being assessed by the UK's medicines regulator. That's the first step in getting the vaccine approved for deployment around Great Britain, and the UK would be one of the first countries to receive it. AstraZeneca expects to have 4 million doses ready for the UK by the end of the year and 40 million by the end of March.